Well, welcome back. It's still Monday the 4th of May. The last video got a bit long, so I thought we'd do a separate one. Now, thinking about New Zealand, one of the great success stories of this pandemic. To be fair, they have done well, but they're also fortunate in that the virus arrived there late and they had more time to prepare, but they've still done well. So New Zealand, very small amount of cases, no new deaths for days. So their deaths still stand at 20 deaths, which of course is a very low case fatality rate. Now, I haven't quite worked that one out, but you can see it's very low. So that's quite encouraging for the rest of the world, because the testing in New Zealand has been fairly accurately used. It's not so much that they've tested masses, but it's been accurate. So this might be a more accurate case fatality rate, which is really very encouraging. And also in the Antipodes, Australia has done very well. Now, I've just been reading about Australia. I'm going to do some more research on this, but apparently the vitamin D levels in the population in Australia are quite good. And I'm going to give you some more evidence later in this video about that. So has this been a factor in Australia and New Zealand? It could well have been. And I'm going to look into that in more detail, but I do have some interesting evidence from Indonesia before the end of this video. Now, just take some data here. This is the numbers of reported cases in Australia. So we can see it's bundling along here. Now, I think it's important to notice that in Australia, this has not gone away. It's not gone away. In fact, you could argue that's an increasing trend over the past few days there. I know it's very small numbers, but I think it just indicates that Australia, while things are good, there's no scope for complacency. There's still undiagnosed cases in Australia, of that I am sure. So there is still risk. So Australia still needs to exercise all of the precautions in terms of social distancing, in terms of hand and surface hygiene. It's not quite out of the woods yet, but it could be. Now the plan is between Australia and New Zealand that once they can get rid of this virus, and New Zealand, I'm optimistic it can. Australia, it's certainly possible that it can. I would say New Zealand's probable, Australia's possible. Then they can have a free travel area between them, because they should be able to get rid of the virus altogether, which would be brilliant. And just to look at another graphic on this. Now, this is New Zealand here. So this is COVID-19 deaths. So this is the deaths. How rapidly are they increasing? So New Zealand, we can see, is virtually flat. And what matters here, of course, is the position of this line. So that's virtually, well, it is flat for the last few days. Whereas Australia is not as flat as New Zealand. Australia's got a slight increase in the death rate. Now, do remember this is a logarithmic scale, 0 to 10, 10 to 100, 100 to 1,000, 100 to 10,000. And just by way of, well, not really comparison, it's just interesting to keep an eye on Canada. The death rate in Canada is still increasing, and it would have to be said that it's increasing, if we look at a line kind of along there, that it's increasing at a steeper rate than Australia. So Canadian measures are working, but still more progress needed. Although, as we know, and we've said many times, that the deaths lag a long way behind the cases. So it could be that the transmission in Canada is already way down. That's quite probable. Now, moving on to the UK. There's no question in my mind now that the death rate in the UK is going to be the highest in Europe. I'm afraid we're already at that was next to 315. That was actually up till yesterday. So that's Saturday, Sunday data, not Sunday, Monday data. So the death rate is really approaching 30,000. It's not far off at all now. Now, this is interesting. There's been, I think I'll talk. Yeah, I'm going to talk about this because it's kind of a change that's happening all over Europe, really. And it's this new idea, and it's called Test, trace, isolate, TTI. Now, I've actually got a note of that there. I was going to talk about it on the last video. Test, trace, isolate. So the TTI strategy. Now, I think this is what we should have been doing all along. And looking back, it's fairly obvious that you need to identify every case to stop the transmission, because if we don't identify every case, then the only alternative is this blanket top-down mass lockdown strategy, which of course is grossly unsatisfactory. So every individual case has to be identified. So that means that anyone who's symptomatic must of course self-isolate, and anyone who's symptomatic should be tested so we know if we're dealing with the virus with a reliable antigen test. Then if that's negative, and as soon as they're feeling better, they can return to normal duties. But if that's positive, of course, then we have to make sure they're isolated for at least 7 or 8 days, or so 7 or 8 days if they're better, but longer if they remain symptomatic, for as long as they remain symptomatic. And of course, we have to quarantine their contacts for 14 days. Now, this is quite a big ask, quarantine for 14 days, but it's better that a few people do it than the entire population do it. It would only be being done with people that had been identified and diagnosed. So we test, trace them, trace the contacts. Who the heck are they? Who are the contacts of this person that's tested positive? And isolate them. That's the TTI strategy. Now, to achieve this, we need great deal of cooperation and agreement and consent from the populace. It's not going to work on its own. So if people don't feel well and they don't admit it, then this is not going to work. They're going to carry on spreading the virus. So everyone must be involved in this strategy. Everyone must be involved. And 14 days quarantine after contact. Now, how are we going to know if you've been in contact with someone who was asymptomatic or pre-symptomatic and had the disease? This is the big problem. So I could have been in contact with someone who was feeling fine. They could have given me the disease. We've both gone away from that meeting, and 2-3 days later they become symptomatic. But all I know is I left a perfectly healthy person behind. How do I know that they have become symptomatic? Well, that's where the tracing comes in. Someone has to take that person and say, well, this person, let's say it's Brian, Brian's become infected. Hey, but Brian met up with John 2 days ago. We better warn John to self-isolate for 14 days in case he's spreading it now, because he could be asymptomatic or pre-symptomatic. See why the tracing's so important. So what my government is doing, and other governments around the world are doing this, is on the place called the Isle of Wight. Now, the Isle of Wight's a very nice island just on the south coast of England, between England and France. They're carrying out a piloting test, trace, isolate strategy using these things. It's going to be an app on your phone. And so you'll have the Bluetooth set on this. And then if you come into contact with someone else who's got the Bluetooth on theirs, then it'll ping. So my phone will remember that I've come into contact with Brian's phone. Then if Brian becomes symptomatic, all the people that Brian has been in contact with will be on Brian's phone. So Brian's phone will send a text to them or saying, "Oi, Brian's tested positive. Isolate yourself for 14 days." As long as Brian does test positive. If Brian tests negative, of course, then it's okay. We can carry on as normal. That's what this is doing. So it's very much like the Australian system. It's a mobile phone Bluetooth ping system. Now, in Australia, the data's been deleted after 21 days. I'm sure in my country we'll do something very similar. It's not a geolocation as far as I understand it. But for this to work, 50% of the population minimum would have to download it. Ideally, everyone downloads it, of course. But it has to be an absolute minimum of 50-60% of the population. So I would appeal to everyone on the Isle of Wight, and if you know anyone on the Isle of Wight, pick up the phone and say, "Oi, get that app downloaded in the Isle of Wight, make this work." Because this is our escape strategy from lockdown. This could not be more important. It really could not be more important. This means we can isolate those at risk, not isolate everyone, as is currently happening. Now, this was good news. An antibody test. Now, Roche Diagnostics, no interest in them at all, no financial interest. But it just sounds good. They announced it in the UK. They've got a new serology test. Now, the blood is in two parts, the cells and the plasma. The plasma part is called the serum, and the antibodies, that are the immune proteins that the immune system makes when it's been exposed to the virus, are in the serum. So when people are talking about the serology test, they're talking about the blood test. They're talking about the test for the antibodies that demonstrate if someone's been in contact with the virus now or in the past. And that is what we're talking about. Now, this new test is supposed to have very high specificity. Now, you might remember that months ago, the UK government ordered 3.5 million tests from China, antibody tests, but they didn't work. They were only about 70% accurate, so they were completely useless. So this one apparently has a specificity greater than 99.8%. It's very specific to the specific COVID-19 virus. Therefore, it's unlikely to say you've got it when you haven't. So it's unlikely to give false positives. So only 2 out of 1,000 should be false positives. So that's good. It's very specific for the virus. It's not going to think that a cold virus is a COVID-19 virus. And it's also, allegedly, got 100% sensitivity. Now, with the antigen test, where you do swabs, nasopharyngeal, oropharyngeal swabs, it's theoretically possible that you have the virus on one part of the mucous membrane and you test on the other part, so you miss it, you physically miss it. So that's possible. So to get false negatives with the antigen test is not remotely surprising. And we know we do. But with this, it's in the blood, and they're saying it's got 100% sensitivity, meaning that it won't be missed. There's a low chance. In fact, that would mean there's no chance. If it's 100%, theoretically, there's no chance, according to that. Therefore, you're not going to get false negatives. So people aren't going, the test isn't going to say, oh, you're all right, mate, you haven't got it, when in fact you have got it. So you're not going to get these false negatives. And that is so important, because if you did the test and you said to someone, no, you haven't got it, then they can go back to work. But if it turned out they did have it, they'd be infecting people. So the worst thing you can do is to say to someone, no, you haven't got it, you're clear. But they actually have got it, then they go and infect other people. That's the worst thing we want. But this test won't do that. It won't give false negatives because it's got 100% sensitivity. So let's just hope it costs about 4p. I suspect it's quite expensive at the moment, but these have to get cheaper because we have to roll this out to the world. And, you know, the other day I was talking about that video. I got really depressed at the end of it and couldn't carry on with the pictures because we were looking at the potential of 40 million or more deaths in the world. If this virus if this test for the antibody can be rolled out to everyone cheaply, it could transform the course of this pandemic while we wait for the vaccine. So let's hope that commercial interests are put aside, because, you know, to say there's tens of millions of lives at stake here is not an exaggeration. It's literal fact. It's literal fact. So let's get a few billion of these, please, Roche, and let's get them bashed out and let's make them dirt cheap, and we'll save a lot of lives. So encouraging. This is even if this is expensive, it's proof of concept. It shows that you can have a test which is highly specific, completely sensitive, and that's exactly what we need. So if that's been done, brilliant. The next step is to make billions of them and to make it cheap. Now, the United States. Let's deal with the facts first of all. Well over 1 million confirmed cases, 67,000 confirmed deaths. On May the 1st alone, in one day, I haven't got the fresh data for the weekend yet, but there was 2,909 deaths in a 24-hour period. So distressingly large numbers. And that's the deaths at the moment. Now, Donald has been saying that there could be up to 90,000 deaths in the United States. The president's been saying 90,000 deaths. Now, of course, this is, given that we're already at that number, I'm sorry to say, scientifically, there's no way that there's only going to be 90,000 deaths in the United States. It's going to be higher than that. Donald is being optimistic. Optimism can be good, but in this situation, I fear that realism is better. Because today, 32 states are starting to open. Now, let's just pause there and be clear what this means. As there's reopening, there's going to be more social mixing. People with the virus are going to infect people that weren't infected before, so there will be more cases. A proportion of those will get quite sick. A proportion of those will need hospitalised. A proportion of those will need intensive care. And a proportion of the hospitalised patients will die. And if there's a great increase, a sudden increase in the number of cases, then there'll be a delay, and then in a week or two's time there'll be a lot of sick people. And in the days after that, a lot of people are going to need to be admitted to hospital. And to be quite honest, even in the United States, I don't see how they're all going to cope at once if there's a lot of reopening. So that's the simple science of the matter as I see it. This reopening will lead to more cases, and a proportion of those will be sick. And I don't believe anyone knows if the United States healthcare system will be able to cope with that. Sadly, I suspect it will not. That means the case fatality rate could be higher because people who could have been saved with medical interventions may not have access to it. Now, I hope that's a very pessimistic scenario, but given the approach in the United States, a lot of people seem to be choosing reopening and freedom over preventing new cases. Now, that's their choice, but it does mean that more cases will occur. It does mean there'll be more deaths. I'll leave that with you. I make no comment on what's right or wrong. I just say that's my understanding of what's going to happen. Now, this was quite upsetting. Gallup in New Mexico, apparently it's part of the Navajo Nation. 173,000 people there. Now, I haven't done a lot of research into First Nation Americans, but I do believe there's quite a high incidence of diabetes and hypertension there. So that's concerning that the serious complication rate amongst Navajo Nation could be higher than amongst white Americans. So yeah, that's bad. I do hope the American authorities are on top of that, and that everyone who needs treatment is going to get treatment. Yeah, quite concerning there for the Navajo Nation. Now, Russia. 10,633 cases in one day. Additional numbers. So we're seeing exponential growth in Russia. And cases increasing very greatly for the last 3 days. Deaths increasing as well. Now, the lockdown measures have been extended by Vladimir up to the 11th of May. So significant lockdown up to the 11th of May. But in Russia, we know there's a lack of PPE. We know there's a great lack of testing. Now, the Moscow mayor, in a reliable news outlet, said that 2% of Moscow is probably infected. Now, if that's the case, if the Moscow mayor is correct, and we've no reason to assume he's not, we can assume the Moscow mayor is guided by good epidemiologists. Then remember that was supposed to be the number of cases in Russia altogether. But I checked on the population of Moscow, and it's 12,000. 190,000 people live in Moscow. Now, if 2% of the population of Moscow are infected, that's 243,800 people infected in Moscow alone. if the mayor is correct. So obviously the official number of cases in Russia is a great underestimate, partly as a result of the lack of testing in Russia. So I am concerned that there's going to be a great increase in cases in Russia, and because of the great limitations in their healthcare system, again, I fear the case fatality rate could be high. And it looks like there's 250,000 people infected in Russia already. Now, maybe 14% of those are going to become quite ill. Maybe 4% of those are going to become critical. Maybe 1% of those are going to die. You don't need me to do the sums. We're talking about a large number of people here at risk. And it's a concerning situation. Now, this new strategy, this TTI, wasn't it? Test, trace, isolate strategy seems to be being extended in Europe now, and it does seem to make sense. So it's test, trace, isolate, TTI, and this seems to be going on all over Europe now. Most countries haven't declared it, but it looks like what the plan is. Now, France has been a lot of cases, of course, as we know, and there's been a lot of deaths. But these numbers do include hospitals and nursing homes, as indeed does the UK data now. And this is the last week of strict lockdown, so it looks like next week the French government are going to start easing the lockdown. And they have launched a state-supported Stop COVID contact tracing app. So it's another one of these things. Goes on your phone. So it's going to be, I don't know the details of it, but it's going to be one of these ping apps. Whether it includes geolocation, I don't know. But just from informal contacts, it looks like people in France will not be cleared to go back to work unless they have downloaded the app. So it looks like it's going to be economically necessary to download the app in France, and that may well be the case in other countries. While Western governments can't mandate downloading apps on your phone, employers can say you're not safe to come back to work without that app, my friend. So get it down, get that app on your phone if you want to come back to work. I suspect that's what's going to happen. I'm a cyclist, so I like the Tour de France. Let's hope it does run on the 29th of August. Time will tell. Now, Spain. Let's just look at a graphic here, actually. So this one, let's go up in a bit. So what we see here is these are the cases these are the deaths, actually, isn't it? This is deaths. Yeah, this is deaths. So this is deaths in Spain, and gratifyingly we see the trend going down quite nicely. Italy, well, yeah, maybe a little bit of levelling off there. Let's hope that comes to nothing. The United Kingdom going down as well, but that's because we've had these lockdown measures, or just coming out of these strict lockdown measures. Now, just by way of comparison, this is China. So these are the official deaths in China, which we now know are wrong. We now know it's an underestimate. But the cases came down. Now, it could be that this is 4 times higher than this, but they have come down. We know that because we've seen the reopening in China. And then farcically, when they recalibrated, the deaths were done. They just jumped up because they weren't they kept changing the way the deaths were changed. So that just shows how ludicrous this data from China is. So was it there or was it there? You know, come on. Anyway, so we know these are accurate anyway from the United Kingdom, Italy and Spain. So looking good there. But these gains, these downward slopes that we're seeing were bought, of course, at the price of the extreme lockdowns in Europe. So they weren't cheap. So we see they've worked, but it's expensive. So cases in Spain, deaths in Spain up 164 was the latest one. That's a relatively small increase in deaths. Still significant, a lot of people, but that was the increase, the lowest increase for some time. In fact, it's the lowest daily number since the 18th of March. So in other words, from March through to May, the Spanish death numbers were going higher all the time, and now starting to come down. Actually, it would have started about there. So the now, what I'm saying is they're now lower. The rate of death is now lower than it was on the 18th of March. The peak was on the 2nd of April with 950 deaths in one day in Spain. And as we know, Spain is greatly easing the lockdown now, as indeed is Italy. Now, Italy, this was the number of cases up till Sunday. That was the number of cases up till Saturday, the increase. So the increase is coming down, but getting on for 250,000 confirmed cases. Now, of course, the real cases are much higher. That was the number of deaths up till Sunday. That was the number of deaths up till Saturday. So again, the death rate coming down. Still, the total, of course, is cumulatively increasing, but less deaths per 24 hours, which is good. And in Italy, that was the lowest number since the 29th of March. But now in Italy, 4.5 million people are going back to work. Great, people going back to work. Takeaway food is available from restaurants. Masks are mandatory outside the home. Masks are mandatory on public transport. This could make a huge difference. I agree completely with this policy, and why my country doesn't do the same, I have no idea. I would predict we are going to start doing it in my country. I do hope so. Parks open for walk or running. Schools in Italy shut till September. And the bad news in Italy is cases increasing in prison. So surprisingly few cases in Italian prisons so far, but now increasing. So I guess that was somewhat inevitable, really. We've looked at that before. It's a problem all around the world. Now, Afghanistan, another one I'm very concerned about. These are the official cases. These are the official deaths. Those numbers can be safely ignored. Now, there was 500 random tests carried out in Kabul. And as far as I know, they were carried out in a genuinely random way. 500 antigen tests. And what they found out was that 33% of the population of Kabul was infected. A third of people in Kabul were infected. Now, again, I looked up the population of Kabul, and it was 4.2 million. 33% of that is 1.3 million cases. So I think if there's 1.3 million cases in Kabul alone, it's unlikely there's 2,704 cases in all of Afghanistan. Now, if this is correct, many of these people are going to get sick. Some are going to require critical care. Many of them are not going to get it, and the case fatality rate, I'm afraid, will be quite high. Brazil is also concerning. Again, riots in prison in Brazil. Thailand, though, is doing well. Now, I'm going to have to delve a little more into Thailand. I'm not quite sure why they're being as successful as they are. But it's looking good. So no deaths reported in days. Masks mandatory on public transport. Brilliant. Excellent. Ban on inbound international flights until the end of May. I think it's going to be longer than that. But, of course, Thailand is very dependent on tourism. Okay, well, that's all I'm going to give you today. That's quite long enough. Let's just look at a few pictures now before we finish. Monday, people. There we go. The people have kindly sent pictures in for Monday. This is Anna, who's an artist in Canada. And I'm glad to see everyone in the room is wearing a mask. I'd love to be artistic. I'm not artistic at all. I hope you can watch me and paint and concentrate at the same time. Thank you, Anna. This is Campbell, whose name I'm almost certainly pronouncing wrong, in New Zealand, who clearly has some quite superb tropical fish. So thank you for watching in New Zealand. Oh, this is Christina in Ohio, who's a graphic, not a graphic artist, ceramic artist. So she makes these excellent artistic ceramics, and later on we might have a picture of some of her ceramics, if not today, another day, because she's made some nice coronavirus ceramics. So a different form of artist there. Christine watching in Ohio. This is Connie from the United States. Looks like she's taking vitamin D. A bit camera shy, but that's okay. Thank you for watching, Connie. This is Dan in Ohio, who's also taking vitamin D. Good. It'd be great if everyone could have the vitamin D levels measured by their doctor, and then so the precise amount could be taken. That would be the ideal situation. So that's Dan in Ohio. Few people seem to watch in Ohio, so welcome everyone in Ohio. Thank you for watching. Oh, Dee slipped in last time as well. But anyway, she's got a nice scarf, so that's fine. We'll allow her to come in. We'll allow her to come in. Thank you, Dee. Now, I'm going to pronounce this name wrong, I know. In fact, I'm not even going to try. Duyga. I'm sure it's a nice name when it's correctly pronounced in Turkish. Watching in Turkey. So thank you for watching. My apologies about my illiteracy. Really pleased you're watching in Turkey. That's great to know. I know there are a lot of cases in Turkey and there's difficulties, but thank you. This is Jeanette in Hawaii, as you can tell from the flower. So thank you for watching in the sunny state of Hawaii. This is Kathy in CA. CA. I put these abbreviations down and I forget what it stands for. It must be California, mustn't it? Is it? Oh, I'm not sure. Sorry, Kathy. I can't really remember. Anyway, I'm glad you're watching in CA, and 50 micrograms of vitamin D, 2,000 international units. That's what I take. So thank you for sending that picture in, Kathy. Thank you for watching. This is another Kathy in France, who's a little bit dark, but there you go. Great to see she's watching in France. Oh, there's those two Polish ladies again. This is Lutch watching in Pittsburgh. Looks cold in Pittsburgh. Thank you for watching in Pittsburgh. On a mobile phone, that's fine. This is Mark in Bermuda. Nice island of Bermuda. Be nice and warm there, I'm sure. And this is another Mark with a different spelling in Australia. So thank you for watching in Australia, Mark. Great country. This is Mary and Pumpkin. Pumpkin obviously is the dog. Like dogs. There's Pumpkin. Never mind me in the corner. So thank you for watching, Mary in Texas. I do hope Pumpkin's well behaved. I'm sure he is. He looks like an intelligent dog. So it's Mary watching in Texas. This is Mike, who watches from the US. So thank you for watching, Mike, in the United States. With the Founding Fathers t-shirt. Excellent. The great principles expounded by the Founding Fathers. So thanks for watching, Mike, in the United States. This is Nico and Andrea. I think you might have been on yesterday, Nico and Andrea. I think you've got away with 2 days there. Thanks for watching. Paul and Karen in Atlanta, Georgia. So thank you for watching in Atlanta. This is Phil in Auckland, in NZ, in New Zealand. Yeah, so thank you for watching, Phil. I think Phil watches when he's out for his walk, so it's a good job there's a fence along here by the river, otherwise he might have an accident. So thank you, Phil. This is Prashant in India. Sorry, Prashant, I've pronounced your name wrong, I know. But delighted you're watching in India. Great to know people are watching in the great, big, populated country of India. With, it has to be said, the best curries in the world. This is Tom. Sorry, Tom, I'm not sure where you are, my friend, but thank you for watching anyway. Good to see you watching. This is Vernon, Max and Teddy. In fact, well, it's not really them, it's their feet. But that's good. Might as well relax as you watch. Watching in bed is completely acceptable. And this is William, I think William's the last. William from Malaysia. Looks like William's a keen cyclist. So thank you for watching in Malaysia, William. Okay, that's us for today. Thank you for coming as always.